Okay, we have a really good session coming up now. They're all been very good, actually, very informative. And this one is really going to focus on survivorship and living to the fullest, to the fullest of your ability. And it's about things like physical activity, nutrition, mental health. And we're going to open it up for discussion as well, because we really want to make this as relevant to the audience as possible. So what I'm going to ask our speakers today to do is to give a really short introduction about themselves, and then we're going to answer a couple of general questions, and then we'll open it up to the audience. So Linda, if you wouldn't mind going first, and take it away.
My name is Linda Trinh. I'm currently an assistant professor at the University of Toronto in the Faculty of Kinesiology and Physical Education. My research program focuses on exercise and cancer survivorship, and I'm particularly interested in developing and implementing exercise programs for improving health-related outcomes as well as quality of life. So that's me.
My name is Haines, and I am a kidney cancer survivor. I had my cancer diagnosis 3 years ago with a radical left nephrectomy. The tumor was diagnosed as oncocytic papillary RCC. At that time, it was stage 3. I'm also a registered psychotherapist and a registered nurse. We'll share. Does that one work? Whoa, that works.
Yeah, we hear you now.
Okay. So I'm a registered psychotherapist, and I'm also a registered nurse. Did most of my educational training in London at the University of Western Ontario, and I currently operate a private psychotherapy practice working with people who've experienced past trauma. My experience with kidney cancer was pretty tough. The emotional toll can be incredibly hard for any of us. And as soon as I found out it was kidney cancer, even though I should have known better, I went to the internet and scared myself to death. So I had a real experience of needing to advocate for myself for the right medical treatment in a timely fashion, because the tumor was yet quite small, was just under 3 centimeters, but when they took it out, it had already reached stage 3, so I'm really glad that I advocated for myself.
Hello. First of all, I want to thank everybody for advocating for themselves just by being here and attending the sessions today. My name is Dawn Knight. I am a registered nurse. I'm an oncology nurse. I actually achieved my qualifications this past July as we call it a Con C. And so I'm pretty proud of that. But I'm more proud by the fact that I get to support each and every one of you every day. I actually do work with, if you are Icelandic, you would pronounce it Bjornsson. If you're Canadian, it's Bjornsson. So I do work at Sunnybrook's Odette Cancer Center, and work with also Dr. Chu, who presented earlier today and will be speaking again later. So my role in the clinic is support, advocacy, but I do like to think that I'm also, outside of the symptoms management and all the other things that go along with being an oncology nurse, is someone who, speaks on behalf, like I said, of the patient, and I really do take pride in that role. So hopefully I can support you today in any of the questions you may have around the topics that we have. Thanks.
Thank you, ladies. So I'd like to maybe start off the session by talking about mental health and kidney cancer. Obviously, it's a very stressful and emotional time when you receive a diagnosis and start understanding treatment options, et cetera. One thing that was really, we had a pre-session kind of call, and one thing that really struck me during that call, I think, Karen, it was yourself who mentioned something that I had not thought about, which is that the diagnosis can often create a trigger for you in your life and bring back sort of other traumas that you have experienced. I'll ask you to lead, but if others want to jump in as well, if you could talk a little bit about that and how you might suggest someone to start to deal with it.
Sure. Triggering, when you receive a diagnosis like this, I mean, right away it's going to mean more medical care. And depending on what you've gone through, before your life to this point in time, it might have involved negative experiences with medical care. It may be a terror of having a needle, maybe past sexual abuse, or a myriad of other upsetting events that set you up for almost at the tipping point of having additional a level of stress that just becomes unmanageable. So, most of the research suggests that up to 20% of people who are given a diagnosis of kidney cancer may develop a post-traumatic stress response. And knowing, or what do you do at that point when you're having symptoms of maybe intrusive memories or flashbacks, can't sleep, your heart may be racing, unable to think about anything but the disease, and you're filled with fear. Recommendations from my own experience and hearing from other people right away is find somebody to talk to, find somebody who's going to offer you support. Family are great, friends are fantastic. Use anybody and everybody. If it continues to be overly difficult, don't take that warrior approach where I'm going to fight it through and I'm strong alone. No. We're social beings. We're designed for connection and support, and that's my recommendation, is to go find it.
One of the things that I'd like to add to that is more from the perspective of when you come to your physician visits and you're speaking with your medical team, is I talk a lot to my patients about the word transparency. Often patients are afraid, worried, develop anxieties around being honest about some of the symptoms they may be having from the treatments. And I think it has a lot to do with, well, if I say something, he's going to change my treatment, or they're going to change my treatment, or actually take me off completely. And that can become quite worrisome for patients. But at the end of the day, you're only advocating for yourself if you're being more transparent with your healthcare team. So that's one of my strongest bits of advice that I give my patients when I speak with them, is about transparency.
And I'm just going to add from an exercise perspective in terms of the benefits of exercise for mental health. A lot of patients, when you ask them what are their main benefits for exercising, part of it is to resume or return to normal activities. And exercise does improve quality of life. It does help you do the activities that you enjoy and that are important to you. So it is key to avoid inactivity and do as much activity as you can tolerate throughout your treatment or survivorship period.
Linda, can you talk to us about what does exercise really mean? Are we talking about, going for a 5-kilometer run? I don't feel like that now. And then treatment really can knock you out for a short period of time. So can you tell us what exercise means and how much should we push ourselves?
I think there's a misconception around exercise, and that when we think about exercise, we think about exercises that we do at a gym. That's structured, that's planned, or we think about having to go out for a 5-kilometer run. But research and evidence actually shows that as little as 30 minutes of walking most days of the week can actually alleviate cancer-related fatigue. And there's also a misconception that you have to accumulate all of this activity at once. So you're thinking 30 minutes. Well, I haven't been active for the majority of my life. How am I supposed to accumulate 30 minutes of physical activity? And I think the important message is that you accumulate it in 10-minute bouts. So if you do 10 minutes in the morning, 10 minutes in the afternoon, and 10 minutes in the evening, you have 30 minutes of physical activity. So there are exercise guidelines for cancer survivors that suggest that you should exercise for 150 minutes of moderate to vigorous activity. So what does that mean? 150 minutes of moderate to vigorous activity means about walking for 30 minutes most days of the week or 5 days of the week. But that can be accumulated in 10-minute bouts. And what do I mean by moderate intensity? Moderate intensity is intensity that increases your heart rate and makes you sweat. Breathe a little bit harder. The good analogy I like to put it with moderate activity is that you should still be able to say a few words or able to talk, but you can't sing your favorite song. So that's when you know you're at a moderate intensity type of exercise. And one of the ways you can gauge your intensity is that when you're going out for a walk, you can walk as if you were late for an appointment. So that is an example of moderate activity intensity exercise. And you can do something as little as walking. Research in our laboratory has shown that any activity, even 10 minutes of activity, can actually lead to reductions in cancer-related fatigue among kidney cancer survivors. And there's actually a recent study that was published looking at associations of exercise and cancer-specific mortality related to kidney cancer, and found that any activity, it doesn't matter if it's light or moderate or vigorous activity, it's associated with at least a 50% reduction in kidney cancer-specific mortality. So that's very encouraging. I think the key message around exercise is, even if you've been recently diagnosed, or if you're a long-time survivor, or you're undergoing treatment, you want to do as much as you can tolerate. You want to avoid being physically inactive. You want to do as much as you can, and if there are days where you're feeling fatigued, you can actually reduce the intensity. You can still go out for that 10-minute walk, but perhaps do it at a lower intensity. So that's the main messaging around exercise. And if you're interested in exercising, I think you should speak to your oncologist or speak to your general practitioner. You shouldn't wait until they bring it up. You should bring exercise to them.
Great. Anyone else want to mention anything before we?
Yeah, I just wanted to mention Cancer Care Ontario under their symptoms tab. So if you Google, I know we were told not to go do all this Googling
Dawn, if you
today,
could just bring that up to
but
you.
Cancer Care Ontario, so CCO, has just come out with some exercise guidelines. If you go under the symptoms management tab, and it outlines everything that Linda was just talking about. It also has a wonderful planner or a guide for your exercise management that you can print off and work through with your healthcare team. So just a bit of advice there.
And just to mention that there is a kidney cancer exercise guidebook for you to, that's distributed free from Kidney Cancer Canada. This is developed by our research team to talk about getting started on an exercise program. And you can download it for free on your Kidney Cancer Canada website. Or there are copies just right outside of the break room.
Great, thank you. I'd like to maybe switch a little bit and talk about how to manage side effects, how to push through them, or maybe even try to minimize them. And I'm going to try to push nutrition into this because it can be one way, but I realize it's a whole other topic on its own. Does anyone want to talk about managing side effects, therapy side effects? Dawn, maybe?
Yeah, I'll lead that. So when it comes to managing your side effects, when you are first placed on any of these therapies, we'll go over the education and behind what will you expect when you're on any of the oral therapies or the immunotherapies or IV therapies. And number one, ask questions. If you're on your treatment and you experience something, be it on the most common list or least common list, ask the questions, connect with your healthcare providers. Most are provided with a contact resource for those side effects, either during the day or I know we have an after-hours program. So connect, number one. Number two, whenever I have the patients come in and they bring family, I call that family member the collector of all things. Because when you come in, you've got the patient standing or listening to, we've been diagnosed and now I have to go into treatment, and all they hear is like Charlie Brown's teacher, wah, 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 because you can only take so much in. So that collector of all things, I highly encourage them to make sure that they gather the information that's necessary to help manage those patients, be it handouts, Most of the cancer centers will provide educational material either in the center or in an educational area. That's number one. But number two, pardon me, ask the questions and make sure you connect with your healthcare team. And again, I'm going to go back to the same statement I had mentioned earlier about transparency. If you're having a symptom, call about it, because something that is not spoken or said, it's not happening as far as we understand, because it's not being mentioned. So talk about it, explain it, and call your healthcare team.
Great. I'm just cognizant of time, so I know that there's going to be questions in the audience. I encourage you to take advantage of these 3 wonderful resources that we have. If you have questions either about mental health, physical, nutritional health, please come to the mic and seize the opportunity.
I just wanted to remind everybody the cancer centers, like I know most of them have nutritionists available on staff, and I would urge anyone who's having problems eating or with appetite or with mouth sores or any of those symptoms that cause you to perhaps become undernourished, to utilize that resource. Oncologists are very receptive to those things, and they'll quickly arrange during one of your visits to have you, see a nutritionist and recommend things that will help get protein and nutrients to your body to, help you get through these treatments.
I'm just asking, maybe from somebody who's had experience. About 5 months ago, my husband Nick was diagnosed with stage 4 kidney cancer. How do you help yourself, your kids, your grandkids, to not have that be almost your whole life?
It's huge. Huge for your family, huge for your husband, for the kids. They know it. They're not stupid. And being upfront about the struggle and actually talking, including them in some of the grieving, allowing them to cry. Grieving is the best antidote or the best way to metabolize depression. Works better than pills. And it's really what my work with clients is all about, is to get them to the point where they're able to feel their feelings and cry. And once you drop into that, it is not a permanent thing. It helps to release. We know that even tears of sadness and grief help cleanse the body, whereas tears of happiness, they don't have those same toxic aspects to them. So we're designed to cry. Including the kids and your grandkids in some of this would be first recommendation. And also, as tough as it is, including some happy times and changing the subject so that the kids can remember the beautiful stuff too. Creating a picture book, a memory book, a photo album is another way to help them begin to talk about the positive, happy memories they've had with you and your husband and the whole. That can help to shift some of the conversation to the positive stuff and the supports that you still have available and the love you have for each other.
One of the services that Odette offers is called the Patient and Family Support Office. And I will often have conversations with patients around making sure that, and I do explain that managing this journey, I know we've used that word a lot today, but managing the journey is all about mind, body, and spirit. And if all those 3 things are not connected, somewhere along the line, something will derail. We often tell patients, don't be heroes. If you need to talk about something, tap into the services that are being offered to you, whether it's your healthcare, your most responsible physician, your oncologists, your nurses, your social workers, your psychologists, your psychiatrists, whatever. Most programs, I should say all programs through the centers, will have services that are offered for both the patient and the family. So again, I do encourage, and don't wait until things escalate and it's just too far beyond comprehension that, oh my gosh, I really need to talk to someone, because things will build and pile up. So you're far better to tap into those services and check in a little earlier on so that you can create a relationship with those other members of your team, because they've become a part of your circle of care, is what we would call that. So make sure that you're using those services. I know it's a little more difficult in the smaller centers, but your family doctor is still part of your circle of care. They may be not involved in the immediate care as it relates to your oncologist and maybe radiation oncologist, but they are still a part of that care. So tapping into them and finding out what they know, what resources are in the smaller communities. I can attest to that. I do come from a smaller community, and I know how difficult it can be to get the resources available to you, not only for the patient, but also for the care providers, because we always say, we need those care providers. You are our shoulders, and we need you to be able to support that patient before, during, and even after that journey has ended. So I think it's, like I said, really important that you tap into the services if you have them, and to look for them. Advocate for yourselves.
I did find, from an exercise point of view, that I was a muscular guy, and by reducing my muscle mass quite considerably, my creatinine has dropped. A lot less impact on my kidney I have left, which I still have cancer on the adrenal gland, but it is a lot less. So weight training, things like that needs to go.
I mean, the exercise guidelines suggest that you should do 150 minutes of a moderate to vigorous physical activity, but also do 2 days, at least 2 days of strength training activities. And these strength training activities can be your own body weight that you can use, or it can be dumbbells or resistance bands that you find at the fitness centers. But you could use your own body weight at home, something as simple as doing chair stands, or doing calf raises, or toe stands. Those are type of activities that you can do in the comfort of your own home. And I really like your suggestion about sharing your story about exercise. And I actually would like to hear more about, what type of exercises you do, and how often do you do it, and what are some of your benefits that you experience?
I actually stopped any weight training, strength training. I just did walking and just extended my walks. If I walked up hills for strength, I do swimming and so it just keeps everything going. That's and then reduce about 70 pounds of muscle. Drastically reduced the strength.
That's fantastic. Thank you for sharing that.
Dr. Trinh, if a patient has had a collapsed lung, the tumor is there, and they are having difficulty breathing, what kind of activities or exercise can they do to help them with the breathing and to get that exercise activity without the capability for that patient when they've had that setback and now that lung's collapsed and they have only one working lung trying to support that system?
Yeah, and I think first speak with the general practitioner or the oncologist to just find out some of the barriers around exercise or some of the complications that he's experiencing. But I think progression is key. I don't think you should go out and try to do 30 minutes of physical activity or an hour. I think if you can just do a little bit of walking, it doesn't have to be high intensity exercise. It could just be something as light as walking around the block or walking sort of a few steps every day to help build that stamina up again. Yeah, that would be what I would recommend.
Thank you. Yeah, he was a very active coach and just very athletic, and now it's a big struggle, I think, for him.
Yeah, and I
it'd be
encourage
good for him to hear what you had to say.
Yeah, and in the Kidney Cancer Guidebook, there's actually a progressive walking program that he can start trying. It's a 12-week program, and it progresses from 5 minutes of walking to up to 30 minutes a day to resume that physical activity level to 150 minutes. So it's a nice progression that you can take a look at if you haven't already, and I'll be available to answer any other questions after.
Excellent. Well, thank you so much. Really appreciate your thoughts. And I know that there's probably lots more questions folks have. So during the break, I think our experts here would be more than happy to take your questions in person. So thank you so much again, everybody.